and I have a tendency to yap. So if I get off track, just give me a look and I'll try to bring it back.
I love a
Yeah,
yap.
so my journey was a bit different. A lot of the people in my cohort knew going into college that they wanted to major in speech, had a family member or just someone close to them that used those services. But I actually found it my junior year of college. I was working in a child development lab and trying to figure out how to merge my love for children with my interest in healthcare. And the PI in my lab actually recommended that I talk to someone who she worked with, and through those conversations, that just like really opened the gates for me. One of the attitudes I loved was that the competition ends once you get into the program. For me, it was the emphasis on just wanting to grow people rather than like fostering like a competitive environment where you feel like you're always trying to one up someone. I felt like the people here truly cared about my success and wanted to help me visualize that success and just reach it to the best of my abilities. Having classes with the same people throughout the entire day is so fun. I will say I'm kind of one of those unassigned assigned seat persons. So I was always sit in the same spot, but as people moved around me, or even just like getting to chat during lunch or do work together in the library, I just found that it was so easy to foster that community. And I feel like it's just given me a wonderful set of people to rely on and hopefully maintain contact with and continue to build on those friendships. So we work throughout the year, spring, summer, fall, and during each of those, we have a clinical placement. So we are working one-on-one with a clinical preceptor, supervisor, whatever you want to call them. And in that, we start off by like observing, and then as we get more comfortable, taking on more of the caseload, more responsibilities. And it's a wonderful model, I feel, to jump right into clinic as soon as you start. You have like a couple weeks to get acquainted with like what the program is like, but to just like get hands-on experience that early is just an amazing opportunity that not all programs can claim they have. I did have a placement in a school in MNPS, which was sort of a full circle moment because I grew up in MNPS my whole life, just for obviously like elementary, middle, high school. So to get to work with children in that system, like I said, really full circle. It was beautiful. I learned a lot from my SLP and just seeing what clinic looks like in a different environment, what therapy can look like. I got to be in our hearing preschool for quite a bit. I mentioned on the hearing loss track, and that was just an amazing time. I learned so much from all of the supervisors there. I feel like I've gotten some awesome mentorships and great advice, and sort of like I mentioned with my cohort, just people that I can contact, people that I can reach out to if I ever need assistance or have a question. It's just a really great way to get that clinical experience, that one-on-one relationship that you get to get. I had finished with a patient, was about to get ready to leave for the day, and as I'm walking through the hallway, I see a patient from, or a client from a classroom I was working um, in a previous semester, and he sees me in the hall and he goes, "Miss Kerissa, it's my birthday." I said, "Oh my gosh, how old are you?" He goes, "I'm 3." And I'm like, "Oh my gosh, you're 3, you're such a big boy." And he said, "Do you want a muffin?" He had a tray of muffins that he brought to his class. And as he's walking towards me, drops all of the muffins on the floor. But that doesn't faze him. He picks one up and he goes, "Here, you can have one." And I'm like, "Thank you so much." I take it. I throw it away discreetly once I get back to the office. But for me, just to hear him talking and asking questions and just being so expressive, to be able to say, "It's my birthday." That's the kind of stuff that you want to hear. That's the kind of things you want to take away. And so, yes, the therapy is important. The evaluations are important, and building those relationships. But just seeing people be people and getting to communicate and interact with their environment. I've had so many instances like that where um, you just get to see people live out their potential, things that you've tried to help them work towards, and then to see them get there, see them get close to there is just so rewarding. And to think that you had a little part in it is just, it's, it just makes my heart so happy, fills me with so much light. The people in charge of our clinical placements, I told them that I was interested in working with children primarily, and we started brainstorming different ways that I could do that. And one of those options was to be in cleft and craniofacial clinic. And so I had not known much about cleft or other craniofacial differences before I got into that placement, but we do have a class on it. So that happened in the summer, and my placement was in the summer. So essentially, I sat down, they told me a couple of options, and then asked me if I had considered cleft. And I said no, but I would love to, because it's a bit of a bridge between medical SLP, where you're like in the hospital working a little bit more hands-on, but also getting to do that like speech and language therapy. And so I found that it was a wonderful merriment of those. Having that experience was just so eye-opening. Again, getting me access to a population that I didn't even know I wanted to work with until I started working with them. I will say that Dr. Valeria Matlock, she is an audiologist my training. She still practices, and she has been truly my rock through this whole process. It's not uncommon, and by not uncommon, I mean very frequent, that I just pop by her office. And it's funny because I'll pop in as if I'm going to spend maybe 1 or 2 minutes in there, and suddenly I'm sitting down and it's been like 25 minutes since we've been talking. But she's just given me a lot of guidance about, I guess, the job search, but also just what it means to be a clinician, what it means to serve our patients and be someone they can count on in this role, because we do carry a lot of responsibility. They look at us often as, a provider that has something they need. And so to balance that and really learn how to make it more of a team effort, and caring for our patients, practicing empathy, and looking at them as a whole person. I feel like she's given me a lot and helped build me in those ways as a clinician. So she has been an amazing, amazing influence on me, and I'll be sad to leave her. So I'll actually be joining Children's Healthcare of Atlanta. So I'm super excited to move there. I'll be on their cleft and craniofacial team, and I feel like I got a really broad look into what cleft care looks like when I was in that placement last summer, but there's so much more to learn, and I've fallen in love with the team. I feel like it'll be a great support system, while also fostering independence in me and allowing me to, make my own way, figure out who I am as a clinician. Obviously, I'll make mistakes, but I'll learn from them. So I'm super excited to continue working with this population, which is truly an honor. And being from Nashville and staying for college and now grad school, I think it'll be a good transition for me to figure out if I want to be in Nashville long term, because it'll always be here. It's a common misconception that once you come into grad school, you'll learn everything you need to know in order to practice. And that is not true. They give you a wonderful foundation, but what they're really trying to teach you is how to think, how to problem solve, how to approach, a patient's chart, or any information you glean from an interview, and figure out a way to serve them as best as you can. See people as people. They come to us because they have a need, and while we want to fill it, they have lives outside of what we get to see. And so just continue to practice empathy, be a resource, be a support for them, because they're probably working through something. And whether or not we know all the details, or can help with all of it, we can help with something. So find that one thing that you're like, oh, I can do this. Find those couple of things. Like, oh, I know exactly what to do here. Or if I don't know exactly what to do, I know who does. I know who I can turn to. And then being okay with messing up, being okay with making mistakes, asking questions, wanting to learn more, being curious. I feel like that can really change the way that you interact with this program and how much you're able to take away from it. Build relationships while you can with the people around you, talk to different professors, and go to different research labs and figure out what they're learning, what they're researching, even if you don't join them. There's just so many opportunities that you have during the 1.5 to 2 years that you're here. So really try to take advantage of all of them.